This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly FANTASIA, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Well, is it cold enough for you? Whoa, you better be prepared when you hit the outside today because it's really, it is cold. Good morning and welcome to another edition of Health Watch. We'll try to warm you up with some good health information here on the show.
But not fire you up.
That's
okay,
right. That's
John.
right. You got it. We'll warm you up with some good information. Health Watch is heard every Sunday here on Talk Radio 1210 WPHT. I'm John DeMasi with the one and only Dr. Molly FANTASIA, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We'll tell you about the who, what, when, where, why, and how of Innovative Medical and how it can help you and your family improve your overall quality of life. And that is the mission statement here on the show, and today is no exception. Dr. Molly's going to explain what it is that you do at Innovative Medical.
Oh, boy.
And that would take more than an hour.
That's right. That's why we encourage people to what? Come in for the free consult.
Come in, yes,
it's the best
yes.
way. But, John, we are a group of like-minded providers. So we're a cooperative of like-minded providers, and we all work out of my facility, which is a licensed primary facility in Marlton, New Jersey. So we're able to do everything you can get done in any primary care office. So if you need to go out for x-rays, we can do it. If you need prescription meds, we can do it. If you need to have something signed for school, whatever you need in terms of your primary docs, we can get it done. But it's really the philosophy that actually changes what we do. What we do is we want to give you whatever prescription you need, but we want to use the least amount of that prescription med to really effectuate the change, keep you safe, get the medical result we want, and keep your quality of life.
And many of the prescription meds, and all the time. Yesterday watching television, here comes another one.
Yeah.
Don't take this if you're this or you're that or you're this or you're that. It's like, don't take it.
Right.
Period. Don't take it.
Well, we all know that when you need a prescription med, you really need to take it. However, what we want to do is be judicious in how we do this and also help our patient possibly get off of it by utilizing natural substances, the kinds of things you would get in the health food store and lately in your pharmacy. So the bottom line is, you really have to be judicious in how you really approach a patient's challenge.
And, this is a big industry now.
Goodness. And it's being taken over by Big Pharma.
Yeah,
so everybody wise up, join the Natural Alliance, okay, because let me tell you, every time I turn around, there's another big pharma company buying one of my favorite brands, which means, guess what? The quality's going down, folks.
That's right.
And we're looking at that. We have really, I will tell you that I've been studying this now for at least 6 months. So there's been some shifts, and yet there's one consistent company that we use all the time, as you know.
Yes.
And they've managed to maintain their integrity and independence.
Is there any side effects from the natural substances?
Yeah, of course. There are many things you shouldn't mix together. There are some things that some people don't. For example, I guess we could look at red yeast rice or red rice yeast, whatever you want to call it. That has a function of the statin. And you can have some of the same effects that you would have with statin. But hopefully, it's going to be lesser than you would with the statin. And if used properly, you probably can use it with other things to help improve the lipids. And therefore, it's a quicker kind of thing.
If you're going to the health food store, it would behoove you to get advice from someone like yourself or your nurse barber.
Oh, yes.
Who knows what aisle things are in.
It's unbelievable.
You go to that store, you go down to aisle 4, and it's right there on the...
Do you understand that Barbara lives for that kind of thing?
I know.
And does a really super good job in looking at this and knowing what's out there. And, actually talking to me all the time about, hey, we should put this, maybe we should look at Molly, why don't you look at the viscosity of this for our IVs? And many times I do. I take advice from both my physicians, my nurses, because why? They know what's hot out there, and they know really how we can help people really get to the other side of their challenge.
How do you avoid some of the pitfalls, though? And I know some of your patients have brought bags in of health food items,
Sure.
And many of them counter other things.
Right.
So how would you avoid that?
Well, one of the things I do is I tell them all, give me a list of everything they're taking, or better yet, bring it in so we can see the brands, and then we need a list of all their meds too, because lots of times there's interference between the natural products and the meds. So again, when you come in for the free consult, that gives us sort of the baseline of what we can do. We get to hear your challenge. We want to know. I start thinking about how would I approach your challenge, and also I want to look at what you've been taking and what hasn't worked for you, and maybe why.
Let's talk about many times you've said hydration is the answer to a lot of the things that we talk about.
It's a novel approach, yes.
But why do you say that?
Because there is no way that you're able to really correct some of the challenges that we have if you don't get enough of a particular substance, i.e. a vitamin, let's say. You just can't be done. And there's no way by ingesting. What are you going to do? Ingest handfuls of your vitamins? Well, I have people who've done that. And I have people who have left other quote-unquote medical practices with 2 shopping bags full and probably spent more than they would for coming to a place like ours.
Yeah. So really, it's the advice that you get that is important.
As well as.
Well,
I would say the advice, knowing what particular protocol is going to work based on some of your individuality, based on the challenge that you present when you come in. Look, we're not a spa, John.
Yes.
That's it. You're not going to come in and say, well, Dr. Molly, I want 3 of these from column A and 6 of these on column B, and that's going to be my trip today. Hello, not here.
I went to a spa the other day for a massage, and they had all these signs of all the things that they do.
Right.
And I said, well, if people didn't know, they would come here they'd get a massage like I did, and they would get other things.
Yes, of course.
And
let me pick one out from column A. It's like a Chinese menu. Bottom line is this, folks. Know what you're doing. Right. Because guess what? It can be a minefield out there.
How many treatments would you expect to get just for a normal condition, a normal problem?
Okay, normal. Well, wait a minute.
What's normal?
Yeah. Come on. Let's define normal. Guy comes in and says, the only thing I got wrong with me is I have a little cholesterol. And then after looking at this, I find out he's had 3 stents. He's seeing a cardiologist who's put him on 4 different medications. This happens every day. I say, listen, sir, you have a little more than just a little cholesterol, right? We have a real metabolic issue, which we'll talk a little bit about in the next segment. But bottom line is, don't walk in and think you're going to walk through the River Jordan and come out on the other side and it's going to be beautiful. Doesn't work like that.
So it's really, I guess yours is a process.
It's a process. It's a process to help you improve quality of life, while hopefully effectuating some change in the original condition that brought you here. Many times it's pain. Many times it's high cholesterol. Many times it's people who've had stents that have clogged. I have cancer supportive treatment patients who are worried that they're not going to get through the treatments because they're nutritionally depleted. And the oncologist said, oh, don't worry about it. Let's start eating some more candy for energy. Wrong. So, really, it's going to depend on what is necessary for an individualized protocol for an individual patient.
855-839-1210 is our number here in the studio. If you have a question or you have a medical challenge that you want to run by Dr. Molly, 855-839-1210. That's our number, and we welcome your calls. And we tell you all the time, call early so we can get your call in, and Dr. Molly can do her best to try to help you out. It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Again, 855-839-1210 is the number. I'm John DeMasi with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, Marlton, New Jersey. We both return after these words. We are back here on Health Watch, and as always, operators standing by at Innovative Medical Associates, 856-489-0505. 856-489-0505 is the number. When you call, you want to make that appointment for the initial consultation, and it is complimentary. So it doesn't cost you anything, and you'll learn a lot, believe me, with Dr. Molly taking more than the 20 minutes allocated.
Yeah, can't help it, Jim.
Yeah, that's right. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. Check that out. A lot of good information on that as well. It's Health Watch, Sundays 8 till 9 here on Radio 1210 WPHT. Our number here in the studio, 855-839-1210, 855-839-1210. You're going to talk about metabolic.
Right. Big word, but
it does sound like a lot there.
Yeah, it's interesting. But let's talk about metabolism. Everybody knows about metabolism, right?
Yes.
We think we do.
Yeah.
But metabolism is actually breaking down your food into simpler components, which is what we use in the hydration bag. So we've already skipped ahead in that process.
Okay.
We've used proteins, carbs, and fats, and some other things. So metabolic disorders occur when the normal process becomes disrupted. So when your normal metabolic process becomes disrupted, you can have a disorder in your metabolism, which means what? You're not going to get enough of your nutrients from your food. So what's a better way to get it than anything else? Hydration.
Oh, there you
Hydration.
go. That word again.
Hydration. So there are many metabolic diseases and disorders that exist, and they're very common in the U.S. You almost wonder why. I start to think about our food supply, for one thing,
Yes.
and also what we're exposed to. So there are examples of metabolic disorders. One example is an inherited metabolic disorders. And what that is it can be characterized by a gene dysregulation. So for some people, they can't break down certain amino acids. One in particular I always go to is phenylalanine. You've heard me speak about that.
Yes.
And actually had a patient whose son had the problem, and he went and was tested and realized he was a carrier for this and didn't know it. So that's one of the things. Also, type 1 diabetes, right, which is the type of diabetes that you have juvenile, they call it, right? So that's an inherited disease where the pancreas does not really create enough insulin to what? To maintain blood sugar levels. So these are kinds of diseases that are inherited. There's one that you cannot break down your fats, and that's called Gaucher's disease. So there are many. Then there are other disease states that cause what? Inflammation, that causes you not to be able to actually break down your food source. So the best way to do this is to utilize hydration and utilize the vitamins, minerals, amino acids that will do the trick for you for your particular challenge, and do it in a way that's really more quickly than through something called food.
Is this because that we eat a lot of processed food?
Yeah, among other
things. Is
yeah.
that really the cause of it?
Absolutely. And I will tell you, the biggest movement right now that I laugh about is something called medical foods. It was another way for lots of big companies, of which we've had in the nutrition business for a long time. Can't say who they are, but people know it. They make drinks,
Yes.
that kind of thing. For people especially who can't eat, they make these drinks.
Yes.
And so they got a designation from the FDA called medical foods. Okay, folks, what are medical foods? Well, medical foods are utilization in a way for you to take in what? Your vitamins, minerals, amino acids that we help bypass through your digestive tract completely. And you know what? You're going to be more effectuated by change through the hydration than even through the medical foods.
Is that the stuff that you drink?
It could be, or you get powders.
Yes, that's
but it's actually been, they've actually put a whole group of medical foods out there, and they're sold by the systems, and they're sold by certain doctors who, use them. The question is, how much do you really need to effectuate the change? I would put hydration therapy done correctly and particular protocols neck to that, and actually quicker results.
When you're talking about metabolic disorders, are you talking about digestive problems? Are you talking about stomach aches?
I'm talking about things like liver problems. I'm talking about heart problems. I'm talking about kidney problems.
Wow.
I'm talking about all of it. When we talk about metabolic issues, we can talk about all kinds of disorders that occur that actually end up causing an inflammation process, which we'll probably get into next segment. But the bottom line is metabolic disorders are something that we should all be aware of. And I would tell you that people with Crohn's disease have a big metabolic disorder, right?
Yes,
they can't
yes.
digest anything.
Yes. So the answer is hydration to this?
Hydration. And why do we want hydration? We want hydration because it can effectuate change much quicker, and it can have you reach a therapeutic level much quicker than any medical food. Guaranteed.
You've often talked about hydration in a lot of different situations, but do you have proof? Can you show patients? Because that's what you get asked, I'm sure.
So what kind of proof do we want? I think the best proof is the proof in terms of the quality of life of our patients.
Yes.
Okay, and that includes you.
Yes.
Where are you post a problem? Pretty
good.
Pretty darn good.
Very
Thank
good,
God.
yeah.
And we're thanking God for that. And believe me, I know he's the big physician upstairs, and you'll never hear me, especially at this time of year, tell people, listen, we have to thank God for all the gifts we've been given. But we've been given a wonderful thing in hydration therapy. And more importantly, I believe in God's ingredients. God has provided us with so many wonderful extractions. Vitamin C, we talk about it all the time, John. I have various extractions for vitamin C. And I know that the body knows the difference between manufactured product and the God-given nutraceuticals.
I want to get back to the genetic component to this.
Wow. That's pretty involved.
It is involved, but can you help a patient who has a genetic component?
Well, yeah, we can help them have a better quality of life. Sure we can. Because if you have a genetic component and it is limiting your ability to necessarily make an amino acid that's, let's say, needed for neuro, right? We can help you with that. If it's giving you a problem possibly with your blood sugar, we'll be able to help you with that. The idea is we're not taking the place of anything you might need in terms of the pharmaceutical, but I bet you we're augmenting that and getting you to feel a whole lot better more quickly.
And what if you have the genetic component, but you don't know about it? I mean, is there
a
test?
Yeah, of course you can do
test?
genetic testing. And more importantly, what has happened is most of my patients, because they're our age or a little younger, people really start to worry about themselves in their 40s. You know that.
Yes.
And thank God they do. But it's interesting because they really sometimes don't even know they may have a gene dysregulation that can contribute to some other kind of challenges. And they may not have a full-blown genetic dysregulation. They may have a partial or a subclinical. So they may have only one gene that may be found, let's say, in a vascular issue. But it's still enough to be concerned about.
I was just thinking of the test you gave me a couple of weeks ago,
Yeah.
which we're going to go over that this week, right?
Sure, yeah. Wait till you see it.
Yeah,
It's unbelievable.
So you do a lot of this kind of testing.
Yeah, and in that case, I'm really looking for something like vascular diseases that are very unique, and we'll talk a little bit about that in the next segment. But I got to tell you, it's out there, folks. The technology's out there, but in the end, isn't it interesting that hydration therapy and the delivery of these vitamins, minerals, aminos, these proteins, these things like peptides, the things that God has given us internally, can be augmented through hydration in a safe, sound medical facility. And there's the difference.
And really, that's the key to this.
Oh, yes.
Because the hydration can give you so much more than you can get anywhere else.
Exactly.
And a combination of things.
Right. And again, listen, hydration's been around for quite a while. It's been used traditionally to deliver certain meds that are necessary to effectuate change. So you can be sure that God's given us a whole lot more in our black bag than people know.
We are about at the halfway point of the show. Believe it or not, time flies when you're having fun.
Yes.
It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. 855-839-1210. That's our number here in the studio. And Dr. Molly would be happy to talk to you and try to help you out with your medical challenge if you have one. Or if you just have a simple question, 855-839-1210 is our number. The show is Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates. And I'm your host, John DeMasi. We both return. More Health Watch after these words. Welcome back to Health Watch. Operators are standing by right now at Innovative Medical Associates. 856-489-0505 is the number. 856-489-0505. InnovativeMedicalAssociates.com is the website. InnovativeMedicalAssociates.com is the website. And remember, if you call and you schedule that appointment with Dr. Molly, the initial consultation is complimentary. All you have to do is show up. That's it. and you're on your way. You never know. It could really help you out. We want to talk a little bit about, before we get back into the show, a couple of weeks ago, I had a facial with Ellie, the esthetician.
Oh, yeah.
And it was great. But the reason I bring that out is that she uses Dr. Molly's line of skincare products. And if you're like fishing around for a gift for somebody, this is a great gift because, I mean, it's something you know they don't have anywhere else. So it's Dr. Molly's line of skincare products, and you simply go to the website, InnovativeMedicalAssociates.com, and you look it up, and you can order it right there. It's really easy, and you can get your shopping done for a person just like that.
Thanks, John.
855-839-1210 is our number here in the studio, and we want to talk about vascular disease, Dr. Molly.
Vascular disease, something we cut our teeth on a long time ago, 26 years ago to be exact. But vascular disease is any condition of the blood vessels, and that includes arteries and veins that are not normal. So blood vessels circulate blood through the body, and problems within this network can really cause all kinds of severe conditions. One of the most prevalent, though, is PVD. It's peripheral vascular disease. What causes that? A buildup of plaque in the arteries that supply blood to your arms, leg, and pelvis. So, you heard me talk about our men's health, just a side note, right? That many times ED is not just a symptom in that area, but it's a symptom of global blood flow. And indeed, that is true. So
peripheral means
vascular means all over.
All over, okay.
All over. And our network is very large, believe me. So here's another thing. You may not have any symptoms of this. Now, we all know diabetics. Diabetics tend to have this, and it's like glaring. But you can have this disease by compromising some of the blood flow, and it sort of is maybe some pain, fatigue that occurs while walking or exercising, and then disappears for several minutes after rest. That's something to be aware of. You really got to be aware of these things. Cold, numbness, sensation in the legs or feet. Now, as we get older, John, I've seen more and more of that just in me.
Yeah.
Okay.
That's
and
right.
I'm telling people, you see it in my office. Who's got their sweater on? Who doesn't? This kind of thing. Leg pain that worsens when the legs are elevated, but improves when sitting. Leg or foot sores that don't heal.
Talk about this patient. I know you wanted to bring this up, who had the foot ulcer.
Yes,
This is really where you can point out that this helps.
Right. And so for her, we had to do a combination of EDTA, which is the plaque extract, and also give her some more nutrition that would help improve the blood flow, get it down there, give her some B vitamins, etc. Certain regulated B vitamins. And in 6 or 7 weeks, she actually was far better than she was. She's been going to the wound doctor, who said, you don't have to come back. He said, it's considerably smaller. Let's just take care of it. I'll see you in 2 months. She was shocked. She came in to see me. She was shocked about it. And I'm shocked as well, but not really, because I've seen this before. But I was glad that it was able to help in such a short time.
You said before that you cut your teeth on vascular.
Yeah, because of EDTA. Inflammation.
EDTA and the chelation and
right,
all of
plaquing.
that.
Plaquing. Right.
I mean, really, I think you had nothing but heart patients for a while.
In the beginning, sure, because I had a spokesman who was very attuned to chelation therapy.
And didn't get cut.
No,
and all of that.
No. So I mean, he was
it's
tough.
Important that
he
you
was
did
tough.
that.
But I want people today, what I'm trying to do is educate people on the risk factors for this peripheral vascular disease. Now, this patient you're talking about didn't have diabetes, and she didn't smoke. She never had a family history of this. So she's sort of an outlier than most people. Most people have PVD, which is peripheral vascular disease, from diabetes. They have a family history of this kind of thing. They're a little bit overweight, high blood pressure, high cholesterol, smoking, and a genetic variant called MTHFR. Forget about what it stands for, but the point is we can find that in your genes and know that you're not metabolizing enough of your B vitamins, etc. And guess what else it does? It elevates an inflammation marker called homocysteine. And you've heard me mention homocysteine before. We test for it. That test that you're getting back this week, you're going to be shocked, because we can measure homocysteine in a very direct way by utilizing a blood sample. So this is very important. So people with diabetes have a greater risk of developing this particular condition. And we really need to look at neuropathy as well. So here's the thing. Neuropathy is a disorder that comes about from decreased blood flow, right? It occurs when the nerves in your body are outside the brain, not in the brain, and the spinal cord are damaged. Why are they damaged, John? Because you're not getting enough blood flow there. You don't get enough of the nutrients there. So how do we know that you have it? Well, sure, it's great to come in when you have a sore in your foot, but I would like you to come in before that.
Right.
So you may have some tingling. You may have some numbness. How many times have we talked to people who said, my arm fell asleep, my leg fell asleep? You ever hear that thing?
Yes. Oh, yeah,
man.
all the time.
Come on. That is a sign. Muscle weakness, cramping, atrophy of your muscle, can't move it. Undetected sores, small sores on the feet. So these are the things. We really got to look at this and say, get in early.
We have a caller. We have Anthony in Belmar, New Jersey. Hi, Anthony.
Anthony.
Welcome to Health Watch. You're on with Dr. Molly.
Hi. Good morning, Dr. Molly. Good morning, John. I love the show. It's awesome.
Thank you. Thank you.
You're very kind.
Thanks. So my question is, I actually spoke with you about a year ago, Dr. Molly. And basically what this is it's the unsolved mystery of statins. So I have a question for you. Right, here we go. So basically, I'm in my middle 50s. I took a CT calcium score test.
Yeah.
The doctor said I had the beginning of a little plaque, and he suggested I take the statins and the St. Joseph's aspirin. Okay, so I did that. I'm really active. I work out like 6 days a week on a treadmill, spend an hour, the whole thing. So I go online, and I see these people talking about statins this, statins that, the pros and cons of the statins.
Sure.
So my question I'm trying to have answered, that every time I put a post up that no one can answer me, okay, so here's the situation. You have some mild plaque and it's in the beginning stages. Don't take the statins. Okay, so what do you do?
Hey, you come on in and get chelation. Okay, you get chelation. I'm telling you, it's unbelievable. Now, no, I'm
I
serious.
had the same
but
problem.
I want to also say, look, I'm
Right.
not opposed to statins, all right. But what I am opposed to is when you keep having to go up on the dosing of your statins till it becomes an impairment
Right.
for some other issues. Right now, I'm going to tell you something, and this is a secret. Oh, thank you, and I appreciate this. I appreciate that you're so knowledgeable, Anthony, and I mean this. And one of the things I would like to tell people is I have a secret. People come into me and they're on a very, very small amount of a statin, very small, the lowest dose, and sometimes they've actually cut it in half. They come, they get some chelation, we follow it very closely, and guess what? They don't need to elevate their statin. In fact, sometimes they can get off of it. Now, I'm not a proponent of you doing it alone. I say you need to do it in conjunction with my physicians, but I'm going to tell you, I don't.
What's that? Hello?
Vacation. Oh, we must have gone out.
we-
John, we must have
we hear him?
dropped. We must have dropped Anthony. But Anthony, I want to say that I have a problem when the medication has to go up and up and up. And I think at some point you really need to look at that and augment your medication regime with something else.
This sounds like my story. Remember that?
Oh yeah. Oh yeah.
I mean, I tried everything.
Yes, we did.
I mean, there had to be 5 or 6 different
Sure.
medications.
All of them.
And all statins.
Right.
And none of them were any good.
None of them were any good for you. Metabolically, you had a problem. So therefore, we really had to look in additional line of medication, which, thank God, they're out there. But again, you're using the smallest dose that is available. And that makes a difference because you're not going to have the side effects of some of these meds. And that's the point of what we do. I'm not saying throw your meds away. Anthony, that's a great question. You obviously are a smart guy. But again, it's not one size fits all.
Yes, and really, he's questioning, and he should be, and he did just what I did. I mean, I remember coming to you saying, hey, none of these things work.
Well, he's doing well, and God bless him. I want him to continue. And I don't want people to think I'm against medication. I'm not. I'm definitely not. But I am against the fact that every time we turn around, it's got to be higher and higher doses, or we got to bring another one in is just as bad. Yeah, maybe 2 medications that come in, if the doctor's wise, of small dose does the trick. Okay, I'm for that. But I'm going to tell you, you're going to do infinitely better on chelation. He laughed when I said that because he's saying, oh, that's Molly pitching her job. But no, to be out there and
Which means you still have time to jump in here with a question or a thought for Dr. Molly, a medical challenge you want to run by her. 855-839-1210. 855-839-1210 is our number here in the studio. Give her a call, and we'll try to help you out with whatever it is the condition happens to be. 855-839-1210. It's Health Watch every Sunday, 8 till 9. Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, and I'm John DeMasi. We both return with more of today's Health Watch after these words. Operators are standing by right now at Innovative Medical Associates, 856-489-0505. That's the number, and that's also the number you can call during the week, Innovative Medical Associates, 856-489-0505, and their website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, if you miss any of today's show, well, we do it again. It's our Health Watch replay this afternoon, 4 until 5, right here on Talk Radio 1210 WPHT. Our number here in the studio, we have some time left if you want to run a medical challenge by Dr. Molly Fantasia, or you want to just talk to her in person, feel free to call us, 855-839-1210, 855-839-1210. What vitamins are good for vascular health?
Oh, John, come on. One of your favorites. First of all, I think people get confused. Veins carry deoxygenated blood from the body's organs and muscles and back to the right side or the right atrium of the heart. And when veins become blocked with plaquing, fat, or some other things, they can't function effectively. This condition, of course, is peripheral arterial disease, which you've heard about too. So a little different, two different kinds of conditions. But the blood in this case may not become serious enough. When it becomes serious enough, it can cause a stroke. It can cause a stroke. So guess what helps this? Of course, that's inflammation. That causes the blood to pool in certain areas. Vitamin C is one of the best vitamins out there for this. Do you believe that?
Wow.
Vitamin C, your friends.
Good for
Why?
everything.
Why? Because it helps strengthen the venous walls, okay? It has anticoagulant properties, which we have to look at many times, which is why I tell you, don't just pick your drip from a menu, a Chinese menu. We want to know that you're on blood thinners. We want to know. We want to use these things appropriately. There are medicinal properties to natural substances. It helps the veins heal from damage. Of course, it reduces inflammation. It helps build the protein collagen. Now, that's all from vitamin C. That's just one vitamin that can help in this case. How about your vitamin E? Oh, everybody talks about vitamin E. Well, vitamin E also is an antioxidant. It helps and prevent and repair cell damage. It can also keep the platelets from sticking together. So, do you just want to go into a health food store, or do you want to go into a spa and say, give me, 10 grams of vitamin E? No. You want to utilize this properly, okay? Vitamin E is also very important to improve the cell health, okay? It's one of the ones that helps improve circulation entirely, all right? So, how about we have the B group of vitamins? Very important. Guess what that's for? Varicose veins, those veins that bulge out. Okay, they can strengthen the blood vessels. So again, vitamin B is very important. So do you think if you have that genetic problem that you can't utilize your vitamin B, do you think hydration might be an answer?
Yes.
Yes, that's right. How about vitamin K? Now, here's an interesting thing. Vitamin K is pretty solid for health, for vein health, okay? You can rub vitamin K into the veins and build up a capillary system. Vitamin K is a strong anticoagulant, so what do you need to do? You need to use it judiciously. You don't just throw a bag of vitamin K on somebody and have them bleed out. I am telling you, the more I see of these particular spas opening up like in 2 minutes, all of a sudden I see everywhere vitamin infusions. Well, let me explain something, folks. You're not getting that at my place. You're not just getting a vitamin infusion. You're getting a protocol.
We should mention that all of your protocols are proprietary and they're your protocols.
Correct.
So you won't get that anywhere else.
No, and it's how we deliver these vitamins and the extracts. You can't patent a natural substance. That's it.
Yes.
So one thing, patent how we deliver it, and that's exactly important. That's and relax. The venous system.
I already know the answer to this, but no.
No. And get vitamin K and vitamin E while you're taking blood thinners? Probably not.
No.
You need to have someone help you with these things. And that types of treatments. That's it. I'm curing the problem, John. Well, I want to give you another problem. And that's the bottom line. And somebody and said, oh my this, I have all these problems right here, but know what you got? He said, well, I got the Boost IV. I said, well, good. God bless you. Okay. Well, they were cheaper than I was.
Yeah.
Okay. And listen, you know the old story, John.
Sometimes cheap is expensive.
Number one.
Yes.
And the other thing is, listen, you got to know what you're putting together for a patient. And believe me, my staff, myself, my docs, we know what we're doing.
Talk about, I know we have a few minutes left.
Okay.
Can you talk about, because Tim, you
Oh,
were telling
Tim.
about Tim.
Tim is our
that was
post-COVID
really
guy.
a good story.
Well, today, and I hope he's listening, because I COVID, and I sees very differently. You know, there are things, a lot of data out there on this, but the thing I like most is he's feeling better. His quality of life is improving, and we all know that long haul COVID is a big problem right now.
Yes, it is.
It's a big problem. And I'll tell you, long haulers are flocking to spas. That's what's happening to get quote-unquote vitamin C. Well, great, but vitamin C alone may not be doing it for you. You may need some other things, and I would not screw around after you've had COVID or had the shot, whatever. I would really look carefully where you go for that.
You know, Tim is doing so well. He told me. I mean, we were just having a conversation. He says, you know, I just feel so much better. And I had the PRP.
Yeah, he had all.
And really, he said, and my wife, you know, she's been
Yeah, of
coming to you
course.
for years. So he said, we're living large, you know.
Yeah, and you know what? I got to tell you something. Here's the thing. He's actually volunteering at my facility because he found that this is something that has such merit for him, and he wants to spread the joy. So he's helping me out this week because Dr. Molly can't be in two places at once. I can't pick people up and then get back to the office. So he's helping me out with that, and I really want him to know I appreciate it very much. But this is the kind of thing, and you know what, John? These are the kind of patients I have, thinking patients, and also good-hearted patients, really, really good people.
It's a short week, and you have a very busy week.
I do.
You have a lot of folks from out of town.
I do, and I had some last week from out of town. My friend actually went back, my patient, she went back and felt. This is my monthly jaunt out to you, and
But you wanted to say
I want
Thanksgiving?
to say happy Thanksgiving, blessed Thanksgiving to all our patients, and to everybody that has put their trust in our facility, our clinic, and in the good Lord's hands. I mean, He is the big physician, as I like to call it, and I thank God every day for the wonderful patients and the privilege of having to treat them in a way like this, and the privilege of our whole facility coming together to help people in their quality of life through whatever journey they're in.
And with that, we put the wraps on another edition of Health Watch. Don't forget, 856-489-0505 is the number, 856-489-0505. And we're going to be off next week. But we'll be playing a best of show.
Best of John.
Best of John and Dr. Molly next week. 856-489-0505 is the number. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget our Health Watch replay this afternoon, 4 until 5, right here on Talk Radio 1210 WPH.D. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, Lana, Catherine, that's our nursing staff, and of course there's Joanne and delightful Dee, fabulous Fran, and our medical assistant Karen Kathy. I'm John DeMasi. Thanks for listening. Happy Thanksgiving, and we will talk to you next week. Health Watch here on Talk Radio 1210 WPHT. You take care, and again, happy Thanksgiving.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.